Welcome to TSI Talks, the podcast where we break down the latest trends, insights, and best practices in revenue cycle management. I'm Marthe, and with me today is my co-host, Heather Beckman.
Hey everyone, we've got an important discussion today, billing and coding changes in 2025. Every year, updates to billing codes and regulations impact how healthcare providers get reimbursed. Failing to stay ahead of these changes can result in revenue loss, increased denials, and compliance risks.
And to help us navigate these complexities, we're joined by Tonya Atwood, VP Operations at TSI, a leading authority in medical coding, compliance, and revenue cycle optimization. Tonya, thanks for being here.
Thanks for having me. I'm excited to discuss the upcoming changes and share insights on how providers can adapt to minimize disruptions and maximize revenue.
Every year, the AMA, CMS, and other regulatory bodies introduce updates to billing codes, impacting claims processing and reimbursement. Let's start with the biggest changes coming in 2025.
The major updates in 2025 are ICD-10 code updates. Over 300 new ICD-10 codes will be introduced, with a major focus on behavioral health, cardiovascular conditions, and chronic disease management. We can expect CPT modifications, expanded telehealth codes, streamlined E&M documentation, and new bundled services to simplify reimbursement. Payers are also tightening compliance requirements, including price transparency mandates and stricter pre-authorization rules for out-of-network claims as part of the No Surprises Act enhancement. Medical necessity scrutiny. The Office of Inspector General and CMS audits will focus on the EM upcoding, telehealth, billing fraud, and insufficient documentation for medical necessity. Providers will need to capture more granular patient data for quality reporting or risk payment reductions for incomplete or incorrect reporting. According to the AAPC 2024 Medical Coding Report, coding errors cost the healthcare industry over $36 billion annually, with incorrect modifier usage and outdated code submissions being their top contributors to those denials.
That's a massive number. If errors are so common, what's the biggest challenge for revenue cycle leaders when it comes to staying compliant?
It's twofold. First, ensuring coding teams are trained on these updates before they take effect, and also avoiding increased denials by ensuring documentation supports the coding changes, especially under the new E&M and telehealth billing scrutiny.
Let's talk about proactive preparation. What steps should providers take today to ensure they're ready for these 2025 updates?
Conduct an internal audit now. Identify your high-risk coding errors and common billing errors before the changes take effect. AI-driven coding assistants can also help flag potential errors before claim submission, which will improve accuracy and compliance. Providers should hold quarterly coding refreshers to ensure billing, coding, and clinical teams are aligned with all the latest updates. Ensure physician documentation captures all the supporting details for procedures and diagnoses. Payers are expected to increase medical necessity denials in 2025 by 15%. Many payers introduce their own rules beyond CMS and AMA guidelines. Having a payer-specific reference guide can help prevent unnecessary denials also. And AI-driven scrubbing tools, they can help reduce denials up to 70%, ensuring first-pass payment rates improve. Healthcare Financial Management Association 2024 report indicates that internal audits experience a 35% reduction in denials due to coding errors alone.
Denials are a major issue, with nearly 1 in 5 claims being rejected. What are the best proactive strategies to mitigate coding-related denials?
Ensure your documentation supports coding. Physicians must document clinical details that justify the code selections. Using predictive analytics, AI-driven tools can help detect common denial trends and flag claims that are at risk before submission. Optimize medical necessity check. Verify that the codes align with the payer-specific medical necessity policies. Encourage real-time communication between revenue cycle and clinical teams. Automate prior authorization tracking. Payers are tightening pre-authorization rules, which makes real-time tracking essential for claim approvals. CMS 2024 Denial Management Report indicates that 86% of denied claims are preventable, yet 35% of providers fail to resubmit them, which ultimately results in permanent revenue loss.
So some key takeaways for our listeners would be start preparing now with internal audits and staff training, use AI and automation to improve coding accuracy and detect errors, and monitor denial trends and payer-specific changes to optimize revenue cycle performance.
For our listeners, if you want to learn more, visit TSICO.com for free resources on billing and coding compliance.
Thank you, Tonya, for joining us today. And thank you to our listeners for tuning in. If you enjoyed this episode, make sure you subscribe to TSI Talks. We'll see you next time.